What's up, Des Moines? Doc Glad here with the Fit Des Moines podcast. Today I have the people's dentist, Dr. Ayah Belbeisi, with Cedar Ridge Aesthetic and Family Dentistry. How are you, Dr. Bilbeisi?
Hi, good morning. I'm doing all right, thanks. How are you, Brian?
I'm doing good. Thank you so much for taking time out of your day to be here.
Yeah, of course. Thanks for having me.
Yeah, no problem. So let's get started. If you could just tell us a little bit about yourself and your background and then what you're up to now.
My name is Dr. Ayah Belbeisi, like you said. I am from Michigan. I studied out there, went to school at Detroit Mercy for dental school, did a hospital general practice residency at the University of Michigan. I've pretty much been mostly in Iowa since. I did a lot of public health work for years, and then went into private practice. And for the past, it's almost 2 years, it'll be 2 years in January, I've been the owner of Cedar Ridge Dentistry here in Urbandale. And I do general dentistry with a personalized, holistic feel.
Okay, so what took you out of like the public health realm and into private practice?
Well, I really liked public health. I loved the idea that I was serving people and taking care of people that often had a hard time getting care. But there were also a lot of limitations. There's a lot of limitations about what I could do, not just because people couldn't necessarily pay for it or Medicaid wasn't paying for everything. There was just a lot of, there was like the boss and then the boss's boss and then the boss's boss's boss. And I didn't really feel like I had a lot of say in what I wanted to do and how I wanted to practice. Yeah. Not that it was, bad. I don't mean to like say anything bad about anyone in particular, but just me personally, I felt like I wanted to do things in a very specific way and I wanted more of that freedom.
Yeah, it's the same. I had the same experience in the Navy. Like it's a bureaucracy, right? There's so many, like you said, there's so many different layers to everything. Like I had a boss and my boss had a boss and that boss had a boss and it just keeps going up. They always say like the Navy's a big ship and it turns really slow. And it's true. You can't get anything done quickly. And it was really frustrating for me too. You'd want to get something done or you want to change something and then someone would stomp on it and say, no, we're not doing that. So
it's just a lot of, and I understand why it was run that way. I completely understood. I mean, that was part of the reason I stuck around for as long as I did, but it just got to a point where I was like, okay, I've had a few years of practice under my belt and they know what my vision is. If I want to do this for the rest of my life, I have to be able to do it my way.
Sure.
Which is why eventually, I made my way here to solo practice.
Yeah. I think a lot of entrepreneurs kind of feel the same way where they want to do it their way and they get frustrated with the like bureaucratic systems like that. So now dentistry, unfortunately, I guess is can be scary for a lot of people and can be off-putting. A lot of people don't like to go to the dentist, but you guys have really done a lot. And I guess in my experience, like your practice is much different than other practices I've been to. And you've made it much more welcoming. You've done a lot of different things to make it a different environment and to welcome people in. So can you talk about like what you guys do different from other practices?
Well, it's nice to hear from somebody who's actually been in, because talking about myself sometimes is really awkward and I don't want to speak for my patients, but so my staff all comes from bigger offices too. Like we've all worked like public health or corporate or something. We've come from these big, busy places. Yeah. And we knew we wanted a place where we were happy to come into work every day and we enjoyed it. And we knew that would translate to our patient feel. So that was like, that's baseline. So, we make sure that we are not like overbooking patients, for example, or like stacking appointments back to back so that we're not rushed with our patients so that everybody has the time they need. That's a big one that we really make sure that we schedule like really nice long blocks of time, especially for the initial visits. We really make sure that we have lots of time to go over everything. We spend a lot of time. That first visit is a really important one. And we really try to have conversations with you, figure out exactly what it is that you want and need, what your goals are, figure out other parts of your health and wellness that could be playing a part to maybe negatively affect your oral health or vice versa, kind of make those connections with you. And then just really figure out the best treatment plan that isn't necessarily like, you know, let's get you some veneers, let's get you a nice white smile. And that's something we do for people who want it, but we don't like to make decisions for anybody. We want our patients to come to us and tell us what they want, and then we're here to guide them and teach them and figure out the best way to do it in a very healthy and smart way.
Can you talk just a little bit? Yeah, I mean, you should probably go into a ton of detail with this, but can you talk a little bit just about like dentistry and how it affects your overall health? I know it's closely tied to like cardiovascular health and things like that. Can you touch on that?
Yeah, so there are so many links. So, you know, with science and medicine and research, it's very hard to get a direct cause effect
Sure.
relation, right? So it's very hard to prove that. But there's study after study after study that shows a link between dental disease or gum disease and other diseases in your body, because gum disease is a huge one. It's an inflammatory disease. So if you have inflammatory markers in your gums, they tend to show up in your heart, in your blood, in other parts of your body. Most recently, there have been some studies showing a link between gum disease and COVID-19 symptoms, and people not doing as well recovering if they're exposed to COVID-19 if they do have gum disease. There was at least one, if not a few studies that I've seen about that recently. So your body needs to is constantly fighting off disease. And if there's an underlying disease in your gums, if there's bacteria or infection, sometimes it's not always bacteria, sometimes it's like fungal infections that grow in your gums that show up as gum disease. And if your body is really busy fighting those off, it's not going to be as well equipped to fight off anything else. So it's huge. I don't want to go into too much detail because it can get.
Well, I
But
figured that was kind of a leading question. Like you could go
yeah,
into a ton of depth
yeah,
with
we
it.
could talk for a very long time. But it's just to keep it simple. If if your immune system is busy fighting off something in your gums, it's not going to be able to take care of your heart as well, or your lungs, or something like that.
Sure. Interesting. So what you kind of talked about a little bit, but how has COVID affected you and your practice?
Well, we were under mandated closure for about 8 or 9 weeks. Where at the time we did it. I mean, we were kind of prepared for that. I actually made the decision to do a short-term close. I think like the day the governor decided to mandate dental offices closed, or like the day before, because we knew it was just really hard to get PPE. We weren't able to get masks or gloves or anything, let alone N95s. I'm just talking about the ones that we were using.
Yeah,
And so we kind of knew we were going to have to cut back. Plus, we started to get a lot of phone calls from patients who just didn't want to come in, didn't feel safe. So we closed down, and it was a nice way for us to kind of reevaluate how we wanted to practice, what we wanted to do in terms of our patients. It taught me how to kind of set up some teledentistry for my current patients. So I did a lot of screening our patients mobily. So we were still open for emergencies.
sure.
We had to come up with, well, actually the board came up with what they considered an emergency, the dental board, and we followed those guidelines. I mean, they were all, everything that I agreed with at the time. And so I had patients that would reach out to me a lot through like social media. I make myself pretty available to my patients.
Yeah,
And so we do some sort of screening. A lot of times I did video calls. And then sometimes I had to come in, sometimes I didn't. And I could just kind of talk them through the issue they were having. So that was like the immediate change. Since then, we've already been really on top of infection control in the dental world. Like we've been wearing masks and gloves for years and years. So that wasn't really new. We did change, obviously, how we masked. We did start wearing N95s and sometimes multi-layer masks. We, at my office invested in, I already had one extra oral suction, but I invested in another system to get even more of that. I put in some UV filters
hmm
to kind of filter the air after, to kind of catch any other leftover aerosol that might be lingering. But other than that, it hasn't been too huge. We're just very aware. And we always have patients would call pre-COVID and say like, I have a cough, should I come in? And we'd say no. You know, that's kind of always been our protocol because we're in people's mouths and we know the biggest risk in dental is to us, the providers, because we're the ones like with the air and the water and everything kind of floating up towards us. So we've always kind of taken that pretty seriously.
Yeah.
It's just added another level.
Yeah. One thing I'm curious about with all this is just, and not just in dentistry, but just in life in general, is like habits that we've gotten used to over the past couple of months. Like, are those going to stick around, or are things going to go back to normal? You know, a lot of people are working from home now, or is it going to stay that way? Are people going to go back to work? How's that going to work? So
Yeah,
do you think like the extra precautions you guys are taking in the dental field, do you think some of those will stick, or?
I do. I really do. I think in the dental world, a lot of the reason we kind of upped our infection control, like the last time we had like a big boom in like the upping of the infection control was around the time HIV kind of started to surface. And so we created universal precautions, which is gloves for everybody, two-handed needle closure, so we're not like poking ourselves, those sort of things. And I kind of feel like this is the next level of that, where I don't think we're going to practice with anything less than a level 3 face mask and a shield, if not an N95. I just can't see it going back. I don't think we'll ever get rid of extra oral suction. I think that's always going to stay now. It's really not that hard. I mean, initially it was an investment, and it was also like a matter of finding these things because everything was sold out and on back order for months. But I can't really see us going back to doing it any other way at this point.
Yeah. Are you guys still having a hard time finding equipment?
Not really at this point. I ordered a lot of it in the early days, and so it's all come in by now. And so there was one item that took many months, and like the company kept saying like, it'll come in, it'll be 2 weeks. Actually, when I first ordered it, the rep said it'll be in 2 weeks. So I was like, perfect. And then they sent me a letter and they were like, we lied. It's not 2 weeks. The nice thing is they didn't charge me until I got it. So I had the whole time to test it out, and they gave me like 30 days. And so that was nice. And I do love it. So
Good.
I'm happy it eventually came in, but
Yeah.
it's a little bit easier. It's kind of funny. There's certain things that were back ordered are just kind of funny. Like the little bags that we give our toothpaste and floss and stuff, and we're back ordered. And we can't get those, even our floss. So we got toothpaste and brushes, but like we can't get our sample flosses in.
Sure.
Those have been back ordered for a really long time. I think it's more just the production, like they've shut down factories and things like that. And I think it's just a matter of getting them caught up.
Yeah.
Yeah.
Before COVID, I was running low on gloves and thought to myself, yeah, I should probably order those, and I don't use a ton of them. So I was like, I'll be fine. And then mid-pandemic, I ran out, and it's like, oh no, I need to get some now. And hopped on Amazon. I was like, if I can get them anywhere quick, it's Amazon, right? And so, and no, there's like nothing on there.
No, even on Amazon.
Yeah, one of them I put in my cart, and you go to purchase it, and right when you purchase it, it changes the date. So
yeah,
like,
that Amazon was doing a lot of that. So luckily we had like right before, we did get some gloves and some level 1 masks. And I know there were a couple hospitals around that were just really, really low and asked for donations. So I kind of figured the level 1 masks would probably be somewhat insignificant after. So I did donate some of those to the local hospital. And I asked if anyone needed gloves, and they didn't. So luckily we had gloves. I wish you would have asked me. I probably could have given you a box.
Yeah.
So luckily we haven't run out of our gloves. That's a good thing.
Yeah, nice. What do you mean by like level 1 mask, level 3? You've kind of touched on that, but
yeah, so that's it's a filtration level.
Okay.
And it's about the size of the particles, but also it's a moisture barrier. So level 3s are more equipped to they don't always even look thicker. Sometimes they look exactly like a level 1, or like the medical mask that you might buy from the store. Now they sell like these disposable medical masks, but the levels are there. They really it's about the way it's made. So some of them have better moisture protection. So the level 3s are going to protect you a lot from things like saliva.
Gotcha.
And the aerosols. Yeah.
Okay. Yeah, that's new to me.
Oh, yeah.
We just don't like.
So for a while, standard for dentistry was like a level 1 was fine, and now, if we use a level 1, it's to protect like our N95 or something, just so that we can kind of stretch it. But
Sure.
we don't practice with level 1s anymore. We use a level 3 and a shield, or like an N95 and a one over it, or multiple. I have my own, we have our own protocol here for what we wear and when. There's some board regulations and we obviously follow those, but then we kind of take it a step further depending on what we're doing.
Sure. Yeah, I was trying to think back to like all my clinical rotations and just my time in the Navy. And I don't think, a couple times in like the hospital setting, we would wear a mask for certain patients, but really in physical therapy, like I've never really had to wear a mask. More people did when we were in Japan if they had a cold or something, but I think that's just more because the Japanese culture, it's common for people to wear masks there, where here in the States it's not. So, but otherwise, like I think we had some in our office, but the providers didn't keep them in their specific offices. So yeah, interesting.
Yeah, we've always worn masks, so they're not that new for us. It's not something that's so crazy for us.
Sure. How did teledentistry go? Because I thought I would just switch my practice over to some telehealth and it would be fine. And I found most people really didn't want to do it. So, and I think a lot of people were just confused on how you would do physical therapy on Zoom or on a platform like that. And so I think there's a lot of confusion with it, and a lot of people were kind of apprehensive to even try it. So how did that go for you?
Yeah, it was, it's not the same. Dentistry is surgical, right? Like a lot of it is surgical to an extent. Like even getting a cleaning is like, we have to scrape your teeth, right? So even on the most basic level, there's some involvement, right? It's very physical, and it's hard to do virtually. It was mostly triaging emergencies. So figuring out, there were some cases that I would say, okay, this is what's going on. Sometimes people just wanted to know what was going on. And sometimes it was a matter of like, okay, you have this problem. Especially, there were some people who like get pain when they have gum disease. And at the time, because I couldn't treat them, I'd say, okay, eventually you need to make it in for a cleaning. Not right now, as soon as the dental office is open again.
Sure.
There were people who had infections where I would offer them, you need this treatment, this treatment. Eventually, essentially needs to be done right away, but in the middle of a pandemic when everything is on lockdown, we might give you some antibiotics and something for pain to help you get through the pain. I think I might have had not too many, but there were some trauma cases where we kind of had to explain what to do. There were a few patients who were in pain who needed to come in, who needed like a filling or a crown or something like that because the tooth broke, or it was just, we couldn't just manage the pain with medication.
Gotcha.
Sometimes when it's so far gone, you have to do some treatment.
Right.
So I did come in a few times for those patients, but the teledentistry or telehealth was mostly, like I said, just triaging, figuring out what the problem was, and then, where to proceed from there.
Yeah, I think that's where it worked the best for me too, with like those acute cases where someone slept wrong and they had a kink in their neck or something like that, where, I could give them a couple quick exercises and give them some advice and get them going again. But yeah. How did you get the name The People's Dentist?
That was something I was called. I was hanging out with some people who had been in my office and were just, it it was almost like I thought it was really sweet because it was a way to describe what I wanted my office and my practice to be without saying it. I was always like, well, I want to be the person it was very hard for me to explain what I wanted. And they're like, well, you're the people's dentist. But I want to be the practice for anybody who doesn't feel like, well, for everybody, but specifically people who just didn't feel like they necessarily had a home or were welcome in other practices. Part of it was also just being socially aware, aware of like social justice causes and like having a say about certain things where I think a lot of doctors have been told to like stay very hush hush about certain things and not have an opinion outside of their realm. And I think that's not just the case for doctors. I know that that's kind of a thing for that people in any like professional, quote unquote, professional job or field are told, like, stay in your lane, stay in your lane. Like you're a dentist, talk about teeth. You know, you're an accountant, talk about numbers. Like don't cross territories or anything like that.
Yeah.
So that's part of it, but also just like I said, I try to be a very inclusive and welcoming, have an inclusive practice. We welcome everybody here. We don't, we try really hard to just not make anybody feel anything less than comfortable and at home. So part of that is even just, you know, we're in network with most insurance companies, which I know you've talked a lot about, you know, insurance and why you're not in network, which I respect. But in dentistry, I know that's just a big barrier for people.
Yeah.
Is that there's the fear of like the pain, but also paying for it. Like
Right.
financially paying is really hard.
Yeah.
So that was why I made the decision to do that. But I also have a membership plan that helps cover a lot of the expense. And I tried to make it as affordable as possible, just to help get people in the door. So that's a big part of it. You know, like I said, it's inclusivity kind of across the board. Whether it's like, you know, different genders, different orientation, different religion, different background, different socioeconomic background. We want to be the place where everybody can just feel welcome and at home.
Okay. What would you say is your number one health or fitness tool?
Health or fitness tool? Well, lately it's been sleep. Sleep has been so important. And I, for so many years, neglected my sleep.
Yeah.
For so many years. Like dental school, like pulling all-nighters. Now I can't even imagine why I would ever do that.
Yeah.
But I know that like if I get a full night's rest where I get like 7 to 9 hours, the next day is significantly better than if I get less. It helps me renew. It gives me, I feel physically rested, but also emotionally and mentally better. So sleep is a big one.
Yeah, I think sleep is totally underrated in its aspect for, like you said, mental health, but just physical health, physical recovery. And so I think I was actually just talking to the gym owner where my practice is, and we were talking about one of the members there, and it's like you could tell she's getting more sleep. She just looks more rested. There's the way she acts, the way she moves, the way she goes through different exercises. It's completely different.
Yeah.
And, it's amazing what getting that rest can do for someone.
Oh yeah, for sure. And for a long time, I was doing the early morning workouts like at 5 a.m., which is really good. I mean, I liked being able to start. I liked starting my day with my workouts, but if I don't get to bed by 9 p.m., I'm not going to wake up at 4:30 or 5. I don't prioritize that anymore.
Yeah.
The sleep comes first and everything else follows, because I know I'm not doing my body any favors by like pushing myself to go do a CrossFit workout on 5 or 6 hours of sleep. It's just, I'm not going to get the benefit out of it, you know? So, I still like waking up early. I think there's a lot of benefit to waking up early. But I try to make sure I sleep and I get good quality sleep. I wear a night guard because I was grinding for a while. So that's a big part of it. Dentistry does play a lot in that. We do talk about things like night guards and sleep apnea a lot, and try to help you and guide you there.
Yeah.
But yeah, it's huge.
Yeah, I'm the same way. If I like 9 o'clock, if I'm not in bed, there's no way I'm getting up to go to the gym.
Yeah. I just don't do it anymore. 10 maximum. Like if it's not if I'm not like asleep at 10 o'clock, I'm not gonna wake up.
No way. Yeah. And
not gonna happen.
COVID, I was great at getting up early. I mean, I still had to go to bed pretty early to get up, but I felt like I could hop out of bed and just go. And ever since then, it's been a struggle. Lately, I've been trying to get back into that routine where I get up early and go to the gym,
Mhm.
but I didn't do that
It's
this morning.
hard.
I'll tell you that much.
I was never a morning person until I had kids, and then they would wake me up at all hours. So then I started waking up at 5.
Yeah.
But my kids sleep through the night now, so I don't need to do that. Like,
Well,
there's
no,
no reason.
no, we don't get that.
Yeah, I don't need to do that anymore. So
Right. I did another interview recently and asked their morning routine, and he was like, "I have kids. I don't have a
yeah,
routine. What are
I
you
mean, my kids are 4 and 6, so they're still young, but at least they're not like infants where they're waking up every 2 hours to nurse or something.
Right. Well, we've got that whole range here, so
Yeah, yeah.
it's difficult, definitely.
Mhm.
So, all right, I've got some Spitfire questions for you, a little bit
All right.
more on the lighter side. This is I didn't send these to you, so sorry.
Okay.
It's not a test. So this is the this or that fall edition.
Oh,
All right.
okay.
So first up, apple cider or pumpkin latte.
Apple cider,
Okay. Flannel or sweater.
sweater,
Okay. Apple picking or pumpkin picking.
apple picking,
Okay. Soup or chili.
chili,
Pumpkin pie or apple pie.
pumpkin pie,
Rainy day or cold sunny day.
cold sunny day.
Okay. Nice.
I'm
Perfect.
freezing right now. I can't believe it was 90 degrees last weekend. I have my space heater on and I'm still in my vest. Like, I
Yeah.
don't like being cold, but
Yeah.
it's
So I'm in my office right now and it's right below our living room and the fireplace is currently on upstairs. So
nice.
I think it was like 66 degrees this morning when we woke up. So yeah, I've got a sweatshirt on and I don't mind the cooler weather, but I don't know. Cold and rain.
It's gloomy. It's the darkness. Yeah, that kind of puts a damper on things sometimes, but
Yeah. Yeah. So I lived 2 years like right around Seattle and it was like this all the time. And
oh yeah.
that was a downer. My wife loved it and I was like, oh
Yeah, I need to see some sun.
yeah.
Yeah. Yeah. Hopefully, we'll get sunny weather again. It's supposed to be like this all week, but hopefully it'll
Yeah.
brighten up a little.
Right. Yep. All right. What do you have any like book recommendations or is there a book you're reading now?
Um, book recommendations. Ooh, there's a lot of good books. Currently, I am rereading the autobiography of Malcolm X. If you haven't read it, everybody needs to read that book, I think.
Yeah.
It's an amazing book. I've read it before and I'm rereading it because I can't go to the library and scroll, and I have it, and I figured I should use for a while. I had put some requested some books online from the library and got them, but it's very hard for me to like find something and request it, and it felt like a process. So
Yeah.
rereading, and I've been trying to prioritize reading every day for a few minutes.
Sure. Do you prefer like reading versus like listening to Audible or anything like that?
I don't commute really anymore, so I don't really listen to audiobooks. When I used to have a longer commute for work, I used to do audiobooks. Um, and I listen to podcasts sometimes if I'm like cleaning or something,
Yeah.
because or there are times I listen to podcasts because they're short and quick.
Right.
But I don't consistently listen enough, so I don't really do a lot of audiobooks anymore.
Okay. Yeah. So I found like audiobooks, I feel productive because I can put some headphones in and then go do the dishes or the laundry or that's
Yeah.
why I listen to a lot of podcasts as well. I'm doing some chores.
Yeah, I only kind of recently got into podcasts, but like I said, because I can listen to like an episode at a time, and I feel like it's less commitment
Right
than an
now.
audible.
Yeah. Well, and sometimes it's hard too. Like I read or I listened to Breath recently, and I felt like I needed to see it like in person and take some notes and like highlight things.
Yeah, that's a part of it too. Like if I want to read a book that's going to be something like productive like that, I want to really focus. I don't want to miss anything.
Yeah, yeah, for sure. All right, Dr. Bilbeisi, is there anything else that you want people to know about you or about Cedar Ridge Aesthetic and Family Dentistry?
Um, come see us. we're doing, speaking of the membership plan, we do have our fall, it's supposed to be a flash sale. We decided to kind of extend it to the end of this month, to the end of September 2020. We are discounting our membership plan, and we're doing 50% off whitening treatments of any kind. So
Okay.
the fees for the membership are never going to be this low again, because in January it's going to go up, and right now it's discounted from its regular. So if you are looking for a dentist and if financial barriers or something that makes it hard for you to get in, we work with you. It's definitely affordable for most people.
Yeah, I had asked you about that recently, and you sent over everything, and you get a ton of value for the price. It's not that expensive, and the everything you get for it, there's a lot.
Yeah, we, like I said, we try to just make it accessible.
Yeah.
So we try to make it a good value so that people can just get the care they deserve.
Sure. Now, if people want to learn more about you and your practice, how can they do so?
Our website is cedarridgedentistry.com. CedarRidgedentistry. You can look up our website. We do have a Facebook page, which is at Cedar Ridge Dentistry. I will admit our Facebook is not the most active, but we're on there. So you could at least message us through Facebook and things like that. We have all of the staff is linked to the Facebook, so you can reach somebody usually pretty quickly. And then I'm on Instagram at Dr. Bilbeisi, at DRBILBEISI. That is my personal Instagram page, but I do sprinkle a lot of dental education posts in there. You get to know me a little better if you want. And you can DM me. I get a lot of DMs about like scheduling or just dental questions.
Sure.
So you can DM me as long as it's an appropriate DM. I will answer.
I really like the dental education stuff you've been putting out the past couple of days. Those are great.
Oh, thanks.
Yeah, keep that up.
Thank you. I will. I was supposed to do another one today or yesterday. I had it, and then sometimes I also, like, I keep my DMs active so I get notifications if people want to reach me, but sometimes I just don't really like to open it up just for my own.
Yeah.
It was a holiday weekend. I was like, I just don't need to be.
Yeah. Well, sometimes you need
doing that right now. And yeah. So I'll be active for like 4 or 5 days, and then I just like need a week off.
Understandable. All right, Dr. Bilbeisi, I really appreciate you taking the time to be here today. Thank you so much.
Thanks for having me.
Yep, no problem.